Hi, I'm Jackie Hellowell. I live in Halifax in West Yorkshire. I am a safeguarding data analyst in my daytime, but I also do voluntary work, and I was diagnosed with DLBCL in August 2019. I had problems that were around my face and head, getting headaches, getting they thought sinusitis initially, and they treated me with antibiotics, and that started in April of 2019. What happened was the pain got worse in my head and my neck, and I then got double vision and went to the doctors again, and the doctor said, you need to go and get a CT scan. I did that and was told that I had a meningioma in the membrane of my brain. So I was put forward to go from my local hospital to the Leeds Teaching Hospital to have a craniotomy to remove that. Once it had been removed, all my pain went away. It was amazing. But then a week after the operation, I had the meeting with the doctor, at which he said that the tumour they got out of my brain membrane was lymphoma, and that I would need to be treated for it as a blood cancer. The diagnosis was only really about 4 months after I initially started to get symptoms. To be honest, that was a huge shock to have that told, but it was nothing that I didn't sort of panic. I thought, I'm across in Leeds, they're really good, they'll sort me out. I have a background as a biomedical scientist, and I know lots of the detail about how things are done as well, and I coped with it. My family in the background were also shocked, which is really hard to see happen. The impact of that diagnosis meant that from being able to go out and do anything anytime, the whole of the family, all 4 of us, had to be really careful. We stopped going out and doing things really that we'd always done on the weekend, like going for meals or going out for walks, seeing animals, etc. And it was a challenge for all of us, really. The additional aspect of it was that I felt a bit guilty about not being able to do the normal things. So that was a hard aspect of it. It was quite up and down, really. I do have quite a positive mental attitude. As I say, with a biomedical and scientific background, I understand a lot of what's going on around me, medical-wise. I coped with it because I trusted the people who were working with me, the doctors, the nurses, pharmacists, etc., that they were doing the right thing. It was after the main part of the treatment had gone that my mental health took a bit of a dive, in a way. I was angry that I wasn't able to do a lot of things, and I was guilty about making my family's life harder as well as mine. When my mental health was not as good, I spoke with my clinical nurse specialist. Clinical nurse specialists are a vital part of the team around patients going through cancer, because they are very empathetic and they know what you're going through because they've done it for years. And she said, we'll get you some counselling. And during that time, I wasn't able to drive because I'd had my licence taken off me. It was all done virtually, so I never met the person, but it made a difference that I could get out of my head the things I was thinking about that were making me feel angry and guilty to hopefully feel better. And it did help me to feel better. I have now been in remission for almost 3 years. Today is the end of January 2025, and on the 16th of February, it will be 3 years since I went into remission. I am a bit of an analyst, and I do like to know the detail, so I knew that I had to go away and try and figure out what was next. But I didn't get much time because they worked really quickly. The team around me straight away got me the appointment in haematology, and at that first meeting I was told a lot about what the treatment was going to be, and given the documentation by the clinician, but then given some time with the clinical nurse specialist for her to go into the detail of what it actually meant, what the next steps were. So for instance, the first thing to do was have a PICC line put in. I'd never had a PICC line in my life before, but they'd said that was the next thing that we needed to talk about, and that they were there on the phone for me at any time if I needed to. It just felt that my needs were being put in great focus here for them to let me know what they were going to do next and what I needed to be ready for, and they did that very well. They gave great detail about why they decided on what they had because of the information, and it was described in a really clear way. I understood what they were telling me, but if I hadn't understood it, I would have asked them to explain it, and I know that they would have. One of the key things is I always take a pencil and paper in with me to a meeting, and whilst they're describing things, I always make sure if I've got a query, I write it down so I don't forget, because there is a lot going through your head when you're being told these things, and sometimes by the time they're finished and say, "Have you any questions?" you've forgotten what you thought about during the conversation. So that's a really useful way of knowing if you've got any queries or any additional questions you want to ask. I was surrounded by a wonderful team of nurses who they learn about their patients very quickly. But I also got every day a visit from my clinical nurse specialist on the ward and the consultant, where they told me about the blood test results, about how things were going, and I feel very lucky to have had a really good clinical team around me who listened and who helped me as needed. I did keep a diary throughout my journey of what was happening every day. That was really helpful for me, partially to keep a record of it. I like to know what's happened to me. I've kept diaries for a long time, but also it allows to get the things that you're thinking about out of your head onto paper, to allow your brain space to be available to be as strong as it can be for you. I am wanting to do my voluntary work to increase people's knowledge of a cancer, blood cancer, that not everyone knows anything about, and that it is a common cancer. It's the 5th most common cancer, but not many people know anything much about blood cancer. I hope that my involvement in voluntary work will help that to get better. We are all strong. We all have our strengths. And what we need to be able to do is use the advice that we're given by the clinical team around us, follow it as well as we possibly can do, but also have time to bring yourself a little bit of things that you enjoy doing to make your mind clear of any concerns that you have about your current position. Because, from the end of the day, I always look back and think, so what's been the positive thing that happened to me today? And there is always one. Sometimes it's sitting down and relaxing. But some days you have some really positive things that you can think about, even through the difficult journey that you're having. I got to a position after treatment, I'd got through all the treatment, where I was cross that I couldn't do everything I used to do. I was angry about things that had happened. I was guilty about what I'd done to my family by having this. And I think I'd try not to do that, really. But that's just my personality, because I think, at the end of the day, you've got to make sure that you're helping yourself. What I learnt about myself through this journey was focusing on trying to move forward. Sometimes I put others first before myself, and I think through this journey it felt a little bit selfish, but I put myself first, made sure I was focusing on myself and doing what I was supposed to do.